experts have seen an uptick in Metro Manila's COVID-19 reproduction rate during the holiday season. To know more about this, we have with us this afternoon Professor Guido David of the OCTA Research. He's joining us over the phone. Professor, first of all, Merry Christmas. Would like to know of the many questions, again, how much of an increase in virus transmission are we actually seeing, the rate, and how serious is this?
Yes, hi, Merry Christmas, Riza, and to all our viewers and listeners. We actually saw an increase in the reproduction number in the NCR. It increased from 0.42 from the previous week to 0.70 as of yesterday. So how much of an increase is that? Well, it's a significant increase, but it's still below 1. So it's still not at an alarming level yet. But we are, of course, monitoring this closely because we're seeing an uptick in the NCR. Now, a holiday uptick is not, it's not something new. We saw this last year around the same time in December. We also had a holiday uptick, so that's what we're monitoring. If this will be something that will be going away after the new year.
Mm-hmm. So, Guido, is this because there's looser restrictions, or is it because people are going out, there's mobility and people are gathering?
Well, the increased mobility and the increased, possibly the increasing number of, social gatherings, personal interactions may have contributed to this uptick. And this is somewhat expected. We were not really, we were cautioning people, but we were kind of expecting people to have or to enjoy the holidays, and this is what happened. So it's not really alarming at this time, but there may be other factors, but we will know maybe after the new year once things become more clear.
Mm-hmm. Sir, some people from NCR went home to their provinces for the holidays. With this, should we expect a surge come January when they get back?
Well, last year we also had an uptick around after January 1, and this was because of more people returning to the NCR, and also because of the testing laboratories resuming operations. Part of the reason for a downtick would be that there are less laboratories open to conduct testing, and once they reopen, we should see a slight upsurge around after the new year, and this may happen. We may see an increase in the number of cases after January 1, but it should resolve after the first week, unless it's something that's a serious concern, that is a serious or something that's causing a reversal in the downward trend that we have been seeing over the past months.
Mm-hmm. Sir, how about in other places other than Metro Manila and NCR? Are we seeing any increase in cases? And again, which parts of the country or areas could be of a concerning situation?
Well, right now, Riza, it's mostly in the NCR where we can see this kind of an increase. It might be happening elsewhere, but because the caseloads are so low in other parts of the country, it's not yet visible to us. Plus the fact that, as we mentioned, many laboratories, especially those that were affected by the typhoon, many laboratories are closed, and that will result in a decreased number of testing in these provinces that were affected by the typhoon. So we don't have a clear picture yet in the provinces. We'll probably know by January. But in the NCR, where it's mostly happening, the 7-day average in the number of cases in the NCR was as low as about 70 just about last week. But now yesterday it was at 200 cases. So we can see that there is definitely an uptick going on. And again, we hope that it's just something that's temporary.
Finally, sir, can you share with us, if you may, the projections for COVID-19 numbers in the country in the next few weeks? And would the Omicron variant be of an effect in these projections?
Yes, definitely, Riza. If there's no Omicron, if we're just seeing an uptick due to the holidays, the festivities, then the caseload will probably decrease to about the same level as what they were just last week, meaning we expect cases to decrease down to about 200 after the holidays, so maybe 200 to 300 per day in the whole Philippines. But if we are seeing a continued increase in the number of cases, if we see something like 500 cases in one day and maybe more, or even, I mean, let's hope not, but even up to 1,000 cases in one day, then definitely we would be very suspicious about what's driving this uptick. If we were seeing that number of cases, then we may start to suspect that there's an Omicron involvement there. But right now, it's too soon to to know either way if it's going to be going back down to 200 to 300, or if it's going to continue increasing to around 500 or even 1,000.
Thank you, sir, as always, for sharing with us your time and your insights. And again, happy holidays. That's Professor Guido David of the OCTA Research Group.